I'm Dr. John Abebe, the Medical Director of Abebe Fertility Center, and you are welcome to this video series on our IVF process at the clinic. Today we'll be talking about preparation for the embryo transfer. All right. What this means is that patients would have had oocyte retrieval 5 days prior to this time, and after 5 days they will have their embryo transfer. What that means is that we do the 5 transfer with a blastocyst transfer. It's important to know that there are the 2 and the 3 transfers. We hardly do those other days of transfer, the 2 or the 3. We do the 5 transfer because that gives us the best outcome. All right. So once the patient has had the oocyte retrieval done and eggs were retrieved, and the day after we've confirmed there's fertilization, then we wait until the day of the transfer to determine how the embryos have performed, how they've cultured. All right. So what that therefore means is that the date of the transfer is known, but the time of the transfer is only communicated to the patient on the morning of the transfer, after the embryologists have checked to see how the embryos have done. So what that therefore means that unfortunately there's few patients who may not have a transfer because the embryos are not viable. It's important for me to state at this point that not all embryos that are generated are transferred. At the Abebe Fertility Center, we are very conscious of success, and so we want to make sure that only viable embryos are transferred, and that is what is done. Embryo transfer is done under anesthesia, under ultrasound guidance, and so what that means is that patient is required to take some course of water, to have some urine in the bladder. The mock transfer details, of course, will be known during the transfer so that we know exactly where the embryos are going to be deposited. This is to minimize the movement of the transfer catheter once the catheter is placed inside the womb. As to the number of embryos that are going to be transferred, that decision is made after we have reviewed the embryos that are available. The patient is usually shown the embryos on the screen, and then we would also ask and decide on the number of embryos that are going to be transferred. Typically, we transfer between 2 to 3 embryos, although of recent we have been discussing and coming to the conclusion that we should be probably transferring maximum 2 embryos. Why? Because a lot of patients who would transfer 3 embryos for end up having 3 or 4 babies, and that is a lot. Okay, so that is something that we are also have decided to do. Although some patients are not too happy with that, they rather want us to transfer 3 embryos. So after the transfer is done, the patient is out of the theater, and within 10 to 15 minutes, the patient is set to go home. Patient is counseled on the do's and don'ts, which would include basically that the patient should avoid sexual intercourse for that period. The patient should not take anything that contains potash, and the patient should go about her regular activity. Patient should not go home and just stay at home and not do nothing. It doesn't. Having an embryo transfer does not mean that you cannot engage in your regular activity, as long as it does not create a lot of stress for you. You can go about your regular activities, and 2 weeks after, you're coming for your pregnancy test, and hopefully we'll be saying congratulations. So that is that about our embryo transfer at the Abebe Fertility Center. So see you in our next video. Have a wonderful day.